Good afternoon and welcome to the Daily Briefing for Monday, May 18th. I'm J.R. Lewis, glad to have you with us on the radio or online. We run these programs in the 1 p.m., 5 p.m., and 8 p.m. hours on KLAM and KCDV, and then they are archived as quickly as Robbie can get them up there at youtube.com/Cordova TV. Mayor Copeland was not available today. He was in the midst of meeting number 6,142. But we are very pleased to have in his place Public Information Officer and longtime public servant in Cordova, Cathy Sherman. So that's who we're going to hear from today on the Daily Briefing. Cathy Sherman, very nice to have you join us on a very busy day of meetings. In fact, you'll be putting on your city councilor hat soon after we're speaking here, and having another pretty, what for a number of business owners could be a pretty important meeting. But why don't we start with the latest test results from the incident management team? What are you guys tracking here?
Sure. So for the period of Sunday, May 17th, from midnight to midnight, we've had 313 tests now conducted. We have one active test result, 277 negative test results, and 36 are pending. And overall, we have a capacity to still test over 1,000 people, do 1,000 tests in Cordova.
Okay. Speaking of Cordova, which is continually becoming my favorite word, there are a number of folks that have been involved in helping spread the word and keep things on course. Who are some of those that the city is appreciating these days?
Well, recently we were talking to all the folks who have been sewing masks for the community, and we have the folks who are ambassadors who walk around down in the harbor area and through town talking to businesses and seeing what they need. And I know over the weekend the ambassadors ran into a number of fishermen who asked specifically for masks and were interested in hearing who had made them. And there's a lot of people in there. It's both women and men, and they're making, I have not been able to get a total yet of how many masks have been made, but it's been pretty amazing, and some of them are even sewing on old treadle Singer sewing machines like I grew up using, and I think that's pretty amazing.
Yeah, it really is. Well, again, Cordova really being at its best in that. Now, there's some news from a place that you spent considerable time and knew much about, and that is our library, which is entering a new phase. What's happening there?
Well, it is. It's pretty exciting, actually, and I know the State Library Association has been working hard with all our public libraries to try and figure out ways to safely kind of reopen library services for the community, and I think the Cordova Public Library has done a great job of doing reading aloud, with Anna doing Instagram readings and pajama readings and all kinds of things like that. But I, like many other people, have been wanting to check out some books, and so beginning today, the library is going to offer curbside library delivery. Wow. And even though the building's still closed to the public, you can check out materials. So what you can do is go to the library's website, which is cordovalibrary.org. They have a link there for our online catalog. And so you can search for books you might want to check out there, and you can even place a hold on a book that you want to check out. And then all you need to do is you can send an email to curbsidedelivery@cordovalibrary.org, or you can call the library at 424-6667 and leave a voice message. And remember to leave your first and last name and a contact phone number that they can reach you at. And then what they're going to do is they have pickups will be available Monday, Wednesdays, and Fridays from 8 a.m. until 10:30 a.m. and then 4 p.m. until 6:30 p.m. And what they'll do is the staff will bag up your items, and they'll give you a call to schedule a pickup time. So you need to pick up at the drop box, which is next to the rear door of the library. and then you can return items in the drop box too. And what their staff is going to do is anything that's returned will be quarantined and cleaned before processing and allowed to recirculate. So we've kind of got steps in place there to manage that as well. And the staff has also said that if you need help finding something or you want to request something that you're not sure we have, just you can email or call, and a staff member can send you a list of suggestions on a certain genre that you might want to read and tell you new books or things like that. So
okay,
we're kind of back in business.
I kind of like how you keep, using this word "we" when it refers to the library. Do you still work there? Are you still a volunteer or something, or is it just habit?
It's just habit, I think, and I haven't. I am still volunteering at the museum, though.
Okay, fair enough. You're entitled to do that. Now, of course, laughter is great medicine, but it's not always the easiest thing to come by in these kind of bizarre times. And one of the things that's been a concern at an international level, you hear this discussed in pretty much every forum, is the stress that can be caused by this. And the IMT has actually curated some assets for folks. I mean, we've talked about the local phone lines that can be called and the local people, but you had some other things to add to that list that might just be easily downloadable or searchable for somebody. So what are some of those?
Sure. And, that's a part of the incident management team is a health component, and not just in case of COVID, that kind of health, but mental health as well. And Sound Alternatives has put together some really great information on how to take care of yourself and kind of deal with issues that might be causing you anxiety. So there's a couple different apps, and I've been checking out a couple of them so far, but one is called Shine, and it helps calm anxiety and stress. And you can just look these up, either Google them or on your phone. But this one offers a special toolkit for COVID-19. It's kind of anxiety with a free app that offers guided relaxation and meditations, daily motivational messages, and it even has an Ask an Expert section. Mm-hmm. There's another one called Headspace. It's also stress, meditation, relaxation, sleep app. And I just read a great article over the weekend, too. I don't know if other people are experiencing these weird dreams, but a lot of the stress of COVID-19 is affecting our sleep. So some of these are specifically aimed towards helping you sleep and helping your brain kind of let go of the stuff you're anxious about. So there's two more. One is the UCLA Mindful Meditations for Wellbeing app, and the Society for Health Psychology, which is from the division of the American Psychological Association, and it also offers a sleep app and resources to address trauma. Okay. So those are all useful things, I think, for all of us.
Sure, yeah. And again, it stress can, not only does it make you feel crummy, but it also suppresses your immune system, and that's not something we want to have in this situation. So managing that is obviously very important. Now, something else that's important, of course, is the rules. These things that have, in theory anyway, contributed to Cordova continuing to have, a totally clean experience, minus that one case that came in and out of town. So what is it that the IMT is hoping that locals are going to do as we wrap up our briefing here today?
Okay, well, and again, I would say City Council meets at noon today, so some of these things I'm going to say may be changing.
That's a good point.
More current with the state's mandates, but as of right now, we still have in place quarantine for anyone arriving in Cordova from out of state, including residents of Cordova. If you come in from out of state, you have to self-quarantine for 14 days. There is free testing, drive-up testing, though, so go ahead and take advantage of that if you are coming in from out of state and quarantining. Wearing mask is still required in Cordova, and especially in the harbor, gas station, anywhere you're going to run into someone in a public space. And to remember that it protects you and it also protects someone else. Social distancing, gatherings of no more than 20 people are allowed, but try and social distance at least 6 feet. And please be respectful of protective measures that are being put in place by our local businesses as they reopen. I know they're working really hard to meet the state mandates and not violate any of the safety precautions for all of our well-being.
Right. Well, and, whereas depending on what kind of news you watch, and I use the word news with quotey fingers, they love to highlight the friction between customers and business owners over this kind of thing. Cordovans know better, and if there was ever a community of people that would be more likely to thank people for being cautious, then it would probably be us. However, it's easy sometimes to forget to offer that thank you and express appreciation for the efforts that they're making. So we certainly join you in recommending that. You mentioned the drive-up testing, by the way. Can we run the schedule for that again quick before we wrap up?
Sure, absolutely. So there is drive-up testing available 5 days a week. It's at different places, Monday and Wednesday from 2 to 4 at Alanka Community Health Center. And it's downstairs right across from the Episcopal Church. You'll see the staff there. And then Tuesday, Thursday, and Friday from 2 to 4 at the Cordova Community Medical Center in the ambulance bay. And I understand they've been having 14 to 15 people a day come in and get testing, so it's being great, being used, and they recommend you call ahead. For Alanka, it's 424-3622, and for CCMC, it's 424-8000. That just helps you get pre-registered, saves you some time. And then, too, they wanted to say that if you can't come in any of those times, just call, and they'll accommodate your schedule.
Okay, good. Well, all excellent information, of course, and testing, as you see the numbers continue to increase, in terms of the number of tests, that's not anybody getting more worried. That's actually a lot of progress that's being made and helps everybody to understand. So if we should have another case, the team will know how to deal with it. We saw a great example of that when the first case was diagnosed, and this team that has been assembled to do this uses a whole lot of talent, including our Public Information Officer, Cathy Sherman. Thank you so very much for being part of this today.
You're welcome. Thank you, JR.
That's today's Daily Briefing. Thanks again to Cathy Sherman, Public Information Officer for the Incident Management Team. And again, as you're hearing this, depending on the time of day, there's a council meeting underway or took place a few hours ago regarding the potential for moving to Phase 2 in the business reopening process. If you are interested, the Chamber of Commerce is a fantastic asset for learning more about who can now open, and I can run the list for you here real quickly in closing. Restaurants are increasing capacity and a few protocols. Retail, personal services, the non-public facing businesses, public facing businesses, fishing charters, social and religious and other gatherings. Those are seeing expanded protocols, in most cases moving the capacity to 50%. Then there are some others on the list now: gyms, fitness and recreational facilities, lodges and camping, day camps, swimming pools, bars, theaters. We don't have bowling alleys or bingo halls, I don't think, unless I'm not keeping up. Libraries, museums, and archives, organized sports and activities have some changes, licensed childcare. So if you're interested in those things, we recommend you visit the Chamber of Commerce because they have links and information that'll be very useful. We thank you for joining us for the Daily Briefing here on KLAM and KCDB. We'll resume regular programming now.